Depression is a serious mental health condition. It impacts how you feel, think, and act. Depression is not just feeling sad or blue, it's not a sign of weakness, it's a real illness that requires understanding and care. Sadness is a normal human emotion. We all experience it from time to time. It's a natural response to loss, disappointment, or setbacks. Sadness usually fades with time. We adapt and move forward. Depression, however, is different. It lingers for weeks, months, or even years. It's like a heavy weight that's hard to shake off. It affects your daily life, making it challenging to work, study, or enjoy activities you used to love. Imagine a dark cloud constantly hanging over you, casting a shadow on everything you do. That's what living with depression can feel like. It's crucial to recognize that depression is not a choice. It's a medical condition that deserves attention and treatment. Depression manifests in various ways. It can be challenging to recognize because its symptoms are often subtle and vary from person to person. Here are some common signs of depression. Persistent sadness, feeling down, hopeless, or empty most of the day, nearly every day. It's like a sadness that won't go away no matter how hard you try to shake it off. Loss of interest. No longer finding joy in activities you once loved. Hobbies, passions, and even spending time with loved ones lose their appeal. Changes in appetite or weight. Experiencing significant weight loss or gain without any conscious effort. Your appetite may decrease or increase dramatically. Sleep disturbances. Struggling to fall asleep, stay asleep, or sleeping too much. You might toss and turn all night or feel exhausted even after a full night's rest. Fatigue and low energy. Feeling drained and lacking motivation. Even simple tasks can feel overwhelming. Depression is not just all in your head, it has real physical effects on the brain. Research has revealed changes in brain structure and function in individuals with depression. One key area affected is the hippocampus, a brain region responsible for memory and learning. Studies have shown that the hippocampus can shrink in size in people with chronic depression. Another crucial change occurs in the brain's communication system. Nerve cells communicate with each other through chemical messengers called neurotransmitters. Serotonin, dopamine, and norepinephrine are neurotransmitters that play vital roles in mood regulation, motivation, and pleasure. In depression, the balance of these neurotransmitters becomes disrupted. Levels may be too low, or the brain may not utilize them effectively. These imbalances contribute to the emotional and cognitive symptoms of depression. Section 4. Untangling the roots, causes of depression. The causes of depression are complex and multifaceted. It's not usually caused by a single factor, but rather a combination of genetic, biological, environmental, and psychological influences. Genes play a role in determining our susceptibility to depression. If a close family member has depression, your risk may be higher. However, having a genetic predisposition doesn't guarantee you'll develop the condition. Environmental factors, such as stressful life events, trauma, chronic illness, or social isolation, can trigger or worsen depression. Early childhood experiences, such as abuse or neglect, can also have a lasting impact on brain development and increase vulnerability to depression later in life. Furthermore, personality traits like low self-esteem, pessimism, or a tendency to ruminate, which means dwelling on negative thoughts, can make individuals more susceptible to depression. Section 5. Seeking light treatment and support. The good news is that depression is treatable. With the right support and interventions, individuals can recover and live fulfilling lives. Therapy plays a crucial role in depression treatment. Cognitive behavioral therapy, or CBT, is a common type of therapy that helps identify and change negative thought patterns and behaviors that contribute to depression. Medications such as antidepressants can also be effective in alleviating symptoms. Antidepressants work by balancing neurotransmitters in the brain. In some cases, a combination of therapy and medication may be the most effective approach. It's essential to work closely with a qualified mental health professional to determine the best treatment plan for your individual needs. Remember, it's okay to ask for help. Reaching out to a therapist, doctor, or trusted loved one is a sign of strength, not weakness.